just brought so much to the team over the last several years since he joined. And so I think he's going to moderate a bit of a conversation for us today. I just wanted to start by saying that, there are many organizations focused on ending homelessness in Atlanta. I think what's unique about Central OAC is that I like to think of it as we empower and enable all those other organizations to do what they do. And for that reason, sometimes we're the unsung hero. We're sort of behind the scenes, but the services that we provide and the advocacy that we do allows people to find and secure housing, to find and secure jobs, to get access to food pantries. So you may or may not have heard of us, but if you've heard of some of the other larger organizations that focus on homelessness in Atlanta, you certainly have seen part of our work through them. So I'm really looking forward to the next 45 minutes with you guys. And with that, I will turn it over to Kimberly to give a bit of an overview of how 2020 has been going so far.
So thanks, Jeff, and thanks, Jeff and Mike, for being here today. I would echo Jeff to say these are two of my favorite people. I could not have gone through the last few months without them. They have both spent numerous hours on the phone with me, especially in the beginning of this pandemic when I didn't know what to do or was concerned about decisions I was making. They have heard me laugh, they have seen me cry, and they've allowed that space, and so I'm really grateful. And I do want to say I'm very appreciative of our full board. Their support during all of this has been amazing. It backed me up, and I would be remiss if I didn't say thank you in the beginning. So I want to just give a little overview about the last few months. As you all know, 2020 has been a whole different kind of year for everybody, not just Central Outreach and Advocacy Center, but certainly it's affected everyone. And it's not been easy. I've been thinking a lot about our work and thinking about how our work is hard work to begin with. We're serving people who are struggling, who have barriers that most of us can't even begin to understand. So even just take 2020 out of it, the work we do is hard. And then add the changes that we've had to take over the last few months into that mix, and it's made work even harder in some ways. I'll start just for 1 minute. We gave you some numbers, kind of what it looked like for us January through March, pre-COVID, and then during COVID since April. You're going to see some numbers. But the main thing I would just point out there, we went from being open 5 days a week to we are open twice a week at the moment, and we've been doing that for, I believe, since June. We are providing services again, where in the beginning, when we did reopen, we were just doing mail check. Now, I'll speak to that a little bit more. The amazing number I want to point out are the hygiene and snack kits. And the reason I want to point out that is you'll see that January through March was a pretty low number, 268, and since April, over 3,000 of those have been given out. Why is that important? I think prior to COVID, we only gave hygiene and snack items out to those that we sat down with one-on-one for services. Since COVID, when we were open just for mail check and now mail check and services, it's been really important to me that we give those items out, partially because soup kitchens closed, places to shower, clean yourself up closed. And even though it's not a full meal, it's not a shower, it's not a sink to wash in, we're giving some items. And the only way we've been able to do that is through volunteers. We've not purchased any of those things. Everything has been donated to us, and every person who came in has been given that bag. So I just wanted to point that out because that's important, and to say thank you to people who have donated. Just quickly, kind of what happened back in March when everything began to shut down, really the first thing I had to do was say, I don't think our volunteers can come. And that was really hard because, as I often say to people, we could not do the work we do without our volunteers, especially with such a small staff. And even though we're operating without volunteers right now, it's not easy. And we're not able to see as many people because it is just staff in there. But that was the first decision that had to be made, and I know it was the right decision. I think blindly thought we could stay open and our staff could do it, even if we served less people. But as shelter in place became evident and things were closing down, I knew for the safety of our guests and our staff, we had to close, and we did that. And then we reopened, and we only reopened for people to check their mail, because without a check or a food stamp card or their ID that they've been waiting on, whatever document, without that, they were stuck even more than they had been. And then eventually we made plans of how can we operate and see our guests one-on-one again and provide the important services that we do, birth certificates, social security cards, IDs, etc. And we worked out a plan where we could do that. So we are open twice a week. We only allow 4 people in our lobby at a time. The other guests that we're going to see one-on-one are sitting in chairs in the lower courtyard area, socially distanced apart. We still do mail check at the door, so people picking up their mail do not come into the center. And so if you've been a volunteer or passed through in our normal days, we could have 75 people in our lobby. So it's a really big shift for us, but it's the way that we are trying to keep everybody safe. Everybody wears a mask, staff and guests. Everybody hand sanitizes, and again, we're socially distanced apart. My team, I'll say before I stop and we'll continue on this agenda, my team has been amazing. Chatrell, Aaron, and Brenna have done everything that I've asked of them. It's not easy because we stop after every guest, we wipe things down, we wear a mask the whole time. It's not easy. They've done it, and I'm appreciative. And for the most part, our guests have been great about doing what we asked of them. So it's different, but we're making it happen. We're continuing to open doors for our people. So that's kind of an overview of what the last few months have looked like.
Thanks, Kimberly. So I think we're going to move to the question and answer portion of today's information. But I want to start with just thanking you and the staff. You called Aaron, Brenna, and Chatrell out. What you all are doing during this time far transcends anything that that we do in the business world. We're very happy and excited about the business that we work in, but at the same time, we understand there's a higher purpose, and what you all are doing and able to accomplish over these last, I believe we're at around 210 days, is just amazing. If you think about the work that you do and the fact that you really need to be in person at a time where, as a country, we have to protect each other. We have to protect the interests of the health and safety of everyone involved. And what you've been doing over these last several months is doing just that. You personally, Kimberly, have to protect your team and your guests as they come in, because sometimes we don't do that ourselves. We're not good at policing ourselves. So I'm very appreciative of what you all do, and I'm thankful that we have your team there for what is very important work. Just because of the pandemic doesn't mean that homelessness has gone away. If anything, it's been heightened, and people need help. And the work that you all do is very important. So, one of the things that's very important is we talk about opening doors as part of the OAC. When you think about this concept around opening doors in the context of COVID-19 and Central OAC, what comes to mind as you've been working through these last several months?
So I'll start with that. Jeff has comments. I'll welcome those too. I was thinking about this question a lot. You know, opening doors in the middle of COVID look so different. As I mentioned a few minutes ago, kind of giving an overview, before March 2020, when we opened our doors, they stayed open. There was no barrier to getting in. We allowed pretty much as many people as wanted to come through our doors and into our lobby as did in one given day. And as I said, there could be 75 plus people in our lobby at one time. There's now a barrier up. There's a table at the door. The door's propped open. And the table is there really for protection of everybody, just so people can't roam in. We do allow people to come in and use the restroom if they ask, because that's important. And there aren't a lot of public restrooms out there. We don't really make that announcement to our guests, but we won't say, no, you can't do that if they come to that. So in some ways, opening our doors looks so much different. In some ways, I feel like we're not opening our doors because we don't allow as many people in, and yet it's what we have to do in the midst of COVID. But now that we are able to provide services again, and we are working to accomplish that mission of opening doors to overcome and prevent homelessness by providing the services that we do. So we've just had to redefine, I think, what that means for us. So Jeff, I don't know if you have anything to add to that.
Yeah, I think that was really well said. As I think about opening doors, it never used to be literally focused on, do we open the doors of the center? The idea, the spirit of it is to open doors out of homelessness. And so we're providing ways for people to do that. But I don't know any business, and I'm involved in quite a few, that had to reconcile with sort of the idea of protecting their team, but also protecting their guests, the people that they serve, the way that Kimberly and the team have. And so I think it really literally has been, what is the right balance? Because it's not, it's not a service or business that can just shut down because there's so many people that need help. And so the way that you guys have done that and pivoted to change up the process, I think has been really empowering. And to your point, it's had you all thinking differently about what it means to open doors in this day and age.
Yeah.
Great, thanks for that. So that leads me to a question about unaddressed needs. Are there any needs that you're noticing that have guests have changed in light of the pandemic?
Yeah, I mean, a lot has changed for our guests. I mean, a lot of the shelter, there were some shelters that closed. If a shelter did not close, then they did limit the number of people that they could have in, so they had less people in the shelters. And I think if you drive anywhere downtown and even other areas of Atlanta, not even downtown, you're seeing more people out on the street and sleeping out on the street. And I think part of that is because even if shelters remained open, they were limited in how many they could have. For us, and some of what we've seen, a couple of things. The mail system itself is slower, and you too may have experienced that. But mail arrives later, and because we're housed on the ground floor of Central Presbyterian Church, which has its doors have been closed since March, mail itself has been a barrier for us. We've had to go pick up mail at the post office, or if it's delivered now, it really can only be delivered on the 2 days that we are there with our doors open. So, that's in some ways an unaddressed need that people would not think about. Social Security office is closed. Department of Driver Services closed. The Social Security office is still closed. We are finding a way to order Social Security cards via mail. It's not been easy. Department of Driver Services They are open now, but they only work by appointments. So like Chitrell and Brenna will make an appointment with a guest, and it's basically now it's about a month before you can get an appointment to go get your ID. Those are unaddressed needs in some ways that are affect the work that we do. The other things I would say is income and employment. People had jobs, they've lost jobs. There's less income. People are losing their apartments that they were barely holding on to anyway. And I think the other thing I would say is I think we've also witnessed just an increase, probably, no, not even probably, in anxiety and agitation. And that's not unique to people experiencing homelessness. You talk to mental health professionals, therapists, counselors, their load has increased because this has been difficult on everybody, including our guests.
Jeff, do you have anything to add?
No, I mean, I was going to say, like, my experience has been hearing from Kimberly and the team, and everything that she said are the things that I've heard. And one of the harder things for us as board members and volunteers is we can't really go down there right now. So, yeah, I haven't been able to firsthand see much of it, but I've heard a lot from Kimberly, and it sounds like those are the challenges that the guests are having.
Yeah, and one of the things that I know we talked a lot about early, Kimberly, is the needs. While they have not changed the amount of things that you need around face masks and hand sanitation and sanitizer and all the things to protect our guests have just been, exponentially heightened. And we've had a lot of conversations, and it leads me to the next question: is how is our board member, as a board member, how have our roles changed? And not I'm not going to speak for the other board members, but for me, it's been really two things. One is our weekly talks on Fridays have been actually good for me as well, and hearing from you. But that's been more important. And then two, all the stuff that you need, all the supplies that you need. You've been great about reaching out to your board and asking if anybody has things like face masks and hand sanitizers and other products to help protect. But as a board member, we have access to a lot of retail and industry that can help with that. Jeff, I don't know if you'd add anything to how you feel like your role has changed as a board member.
Yeah, I think there's a couple of things. The main thing is that during a crisis, that's one of your best opportunities to evolve as a leader, as a human being, but certainly as an organization. And we had a board meeting recently where we did a lot of brainstorming, and really for the first time in a long time thought about how do we serve our guests in this new world, but in new and interesting ways, and is there an opportunity to evolve? And I thought it was fantastic. So it's interesting because I think certainly emotionally checking on Kimberly, the way that some of my mentors check on me, I think that's been something that I paid more attention to, because this is a very difficult time, but also much more strategically as well, because we have to make sure that we come out of this stronger and better, and to live our mission better. So I think it's changed, and I think just being there and listening has become maybe the most important role for us as board members.
Well, and then that'll lead to a question about how is the board helping Kimberly, and Kimberly, how are you thinking about the future needs and anticipating what those future needs will look like?
Sure. So Jeff just mentioned that at our last board meeting, we had a breakout session. We basically divided the board, and I invited our team, Chitrell, Brennan, and Aaron, to also be a part of that board meeting. But we had 3 breakout groups. We had one that focused on services, one that focused on the mainframe job readiness, and one that focused on marketing and fundraising. It was one of the best board meetings we probably ever had, and the breakout sessions were awesome. The only bad thing about it was I couldn't be at all 3 and listen. What we did from there was I asked my team to make notes about what was talked about in each of those groups. I then compiled those notes together. I asked team then to go back and look at it and kind of prioritize what are these areas should we be working on in the next few months when we know that the way in which we operate still has to look a little bit different. And so we are working on that, and we'll be implementing some new things, and we'll share that with you all through newsletters and social media. So we'll keep you informed of what we're doing, but excuse me, always trying to figure out in the midst of this crazy world, how do we best meet the needs of our guests and do it in a way that's safe for everybody. So I don't know, Jeff, if you have something to add to that, I would welcome that. And then I want to say one other thing, kind of on a bigger picture that we're doing. But if you have anything to add to that, I want to give you that space to do that.
The only other thing I wanted to point out is I think that you've done a really good job of connecting with partner organizations during this time, hearing from them, so that everybody can be learning together. It's one of the unique industries, I guess, where you're all fighting for the same goal, right? So it's not competitive. And so I've seen you talk to other EDs and other CEOs of organizations working to end homelessness. And, that's something that I think everybody can take a lesson away from, but I've applauded you for that.
Thanks. That kind of just leads into what the other part I wanted to share. Yeah, I've been on, in the beginning and for a few months, it was weekly calls with our continuum of care. And so that we could hear what's going on bigger picture wise. And that's gone down to every 2 weeks now. But the things that we learned were about COVID testing for people experiencing homelessness and what does that look like and what does the shelter situation look like. And that kept me very informed. And as a result of that, one of the goals of our continuum of care is there's a very large number, close to 800 people who have been in a housing queue. So what that basically means is they did an assessment was done with them to evaluate how vulnerable they are in the homeless situation in which they find themselves. The higher somebody's vulnerability is, those people should be placed into housing first. And then they work down the list. Well, there's a large number that's been in this housing queue for a while. So the goal in the middle of this now is to try to get as many of those folks housed so that they're not continuing to be on the street. This is going to take really every agency that's involved in the continuum of care to make it happen. We've been a part of conversations. Chatrell and I had some additional conversations in the last month about what our role at Central OAC could be. We thought about taking on something new, and it just didn't sit right. And what I did was go back to what we always need to do is look at our mission. We open doors to overcome and prevent homelessness. And whatever we do needs to fit that. Well, what do we do best? I mean, what do we do so well? And that really is, a lot of that is helping people to obtain identification. And I say this over and over to people, that is the very first door out of homelessness. A person cannot obtain housing if they don't have the documents we provide. So we are hoping week after next that we will open an additional day. That morning we'll focus only on people who are in that housing queue, working with a case manager to bring those guests in and to work with them on whichever pieces of documentation that they still need. So that's one way in which we're looking forward at the future, but a little bit bigger picture of this and really trying to do what we do well, but work in collaboration with the other agencies.
Are there any, a question came in through the chat. Thanks, David, for providing it. But it's actually a really good question around, the next 3 to 6 months. Are there any specific plans or things that are needed for the OAC?
Yeah, I mean, Mike, you mentioned this a few minutes ago about face mask and hand sanitizer. I don't foresee that changing anytime soon. I would love it if we did not have to all wear a face mask, but we're going to have to do that. And I think that's going to continue the next 3 to 6 months. And so a lot of our guests show up at our door and they already have a face mask, but some don't. So we want to always make sure we can hand them one, or sometimes it's really dirty, they want a new one, fine. You know, I have the luxury of washing mine, so they don't always have that. So that's huge for me. Absolutely. I think continuing to donate snack and hygiene items, because I still feel pretty strongly that everybody who comes to our door should be given those items. And in some ways that stuff probably seems small to people, but I think it's really huge for our guests.
What about opening up the doors more than 2 days per week?
So we're trying to work on that, and how can we do that safely? So a little bit of background with that. Part of the reason we chose a Monday, Thursday schedule is we utilize the custodians of Central Presbyterian Church. They do the cleaning of our center. That's been the relationship forever. Our staff is cleaning in the sense of, let's use Chatrell for an example. When she finishes seeing a guest for services, before she can call another guest back, she has to wipe down every surface area that has been used in that room and make sure that that's clean before she calls the next person back. At the door with the table, the barrier I talked about, we don't do it after every guest, but after 10 or so guests, take a moment, spray it down, wipe it down. Again, just trying to keep everything clean. The Monday, Thursday schedule in the beginning was used because the head person over the custodians at the church, there was so much unknown about this virus, and there was a lot of discussion about how long does the virus stay on a surface or in the environment. And it was trying to protect the custodians and not bring them in and have that opportunity, that possibility that they could contract a virus from one of us or a guest, whomever. If we open up, not if, I'm pretty sure we'll do it. We're going to have a schedule of Monday, Tuesday, Thursday. Tuesdays will be our days to work with those guests who are in a housing queue. We do have the agreement now that a custodian will come in that afternoon and clean. So we're moving more towards that. I'm sure people are asking, why are we not back to 5 days a week? I ask myself that almost daily. It's hard. It's hard because I know our guests need those services and need our doors to be opened. I also know how hard it is to work in the midst of it every day. Where and we're not the only people. I'm not saying that at all, but we're wearing a mask the entire morning, really without a break. It's draining. So we do have, in addition to the 4 of us, we have a Georgia Tech student who's been a volunteer. We're actually paying him right now. He's with us on Thursdays, and we have 2 social work interns that we're trading. So we have increased our number a little bit. And I think we may be able to get to where we can open an additional day or so and do some rotating of staff rather than it being just the 4 of us doing it 5 days a week. I think that break will be, I think, again, it's a way to keep everybody as safe and healthy as possible.
Okay. And we can see, your passion is evident on your face. And that's one of the things that we love about you, Kimberly, and the way you approach this. So, so never lose that. But,
I was trying not to cry today.
It's okay. It's all, we all cry with you. Kind of shifting gears, Lee asked a question in the chat about how has COVID period impacted our financial support and giving from donors. If you could comment on that.
Yeah, absolutely. We're okay financially, and I'm very, very grateful for that. We've had some nice gifts come in, I think, that were unexpected. Um, Board members have stepped up, and that's always a positive, and we're grateful for that. We've seen a little bit through foundation money. So we apply for, everything possible. And some of the foundations, the response that we got back from them was they were waiting a little while before they made final decisions. And we don't know what all is behind that. They didn't give further reasons. But it would be helpful really just to go ahead and know, no, we're not going to be able to fund you, but wait, instead of just telling us to wait. I think individual giving may be down a little bit, and we're gonna be doing some reaching out from November through December. We've got plans. I was on my weekly call yesterday with our development team, and that'll begin November 1st. I'm really excited about that. But we're sound right now, and we're grateful for that. And I'm going to trust that the work we're doing to try to keep that going, budget-wise, I'm going to stay positive and believe it's going to continue to happen for us.
Okay. And we're running right on a little bit late, but I'll end with the question of, there's a lot of people on the call today. How can supporters of Central OAC become everyday advocates for the organization, and what needs that can provide to you and the staff?
So for me, I think one of the best ways is to follow the work we're doing. If you receive our newsletter, great. If you don't, ask us to add your name to it. If you're on social media, follow us, watch what's happening, because Brenna does a great job of communicating through those means. But don't just look at it. Share it with your friends, with your family. Tell them about the work that we're doing. Invite them to follow us or sign up for our newsletter, because we keep you informed that way. And I think that's just one of the best ways to be an everyday advocate. And then as you do that, you're going to see or be invited into other ways to advocate on behalf of those experiencing homelessness. And that's what we're all about, is working with our guests.
Great. Well, thank you. And thank you everything you all are doing. I'll end with the same comments that I started with, is the work that you're doing is so important. You talked a little bit about the anxiety that people are feeling, and there's no more important thing that you're doing than providing hope to people that really need it. So thank you for that.
Thank you, Mike and Jeff, and all of you who joined us today. We're really grateful.
Well, if you do have some other questions, we always welcome them. You can certainly email Kimberly when you receive the link. Her email was in there. So always excited about staying connected. And as she mentioned, you will be hearing from us in your inboxes and on social between November and December. And we thank you again for joining us.
Thanks, everybody.
Thanks.